Hey there, everybody. It's Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, Canaan. Today, we're gonna jump ahead and think of warmer times. And the one thing I want to talk about is tennis elbow. Now, tennis elbow, whoever considers tennis elbow at this time of year? A lot of people do switch to indoor tennis or indoor racket sports. Well, around here in the Stamford, Darien, Norwalk, Canaan area, or if you're in warmer parts, you're probably still enjoying a game of tennis and or golf. And the reason why I'm including golf with this is because tennis elbow is lateral epicondylitis. That's the fancy term. Great one if you're ever playing a game, a board game. You need some long words, but medial epicondylitis is golfer's elbow. So you have two different things, but very similar. Ones they're both overuse syndromes. Um, they tend to hit specifically with racket sports or golf sports. You know, so why am I bringing it up now? Because I've gotten a couple inquiries about it. So, question here is okay, and we'll stick with tennis elbow. We'll try to get a little bit into golfer's elbow. How do you get it? It's an overuse syndrome of the muscles in the forearm, and it creates tension on the lateral epicondyle. And repetitive overuse tends to strain it. So, it's a physical stress placed on the lateral epicondyle. So, you have certain muscles that attach there, and those muscles become inflamed and irritated. And if you just rely on Advil Aleve or certain creams, you're going to get minor results. I mean, and if it helps the pain, that gives you an idea. It's not a major type of a problem. And then you just use a little bit of ice, and the problem should go away pretty nicely. You may want to get one of those a support, an elbow supports. There's a brand called Chopat, CHO hyphen PAT, and it's actually put below the elbow, okay, close to your hand. And when you use that, it tends to take the force away from the epicondyles. So those work pretty well. And if you do have those things, it resolves. Then you really don't have a true case of tennis elbow or golfer's elbow. And the question we get is, you know, how do you make it go away? Well, certain exercises will aggravate it. Pull ups, chin ups, and bench presses. You may want to stop doing what you're doing and give it a bit of a rest. And again, ice. People sometimes think heat helps. Heat can help beforehand, but not initially right afterwards. Ice, you want to freeze it up and keep the inflammation away. Now, if you warm it up and you get blood flow to the area, that may make it better. So before heat, after ice, typically is the way I would recommend you address the minor aches or pains associated with tennis elbow. Um, Here's a crazy question: what helps overnight? I would say you get more of an elbow sleeve. That's different than the chow pat. It's a sleeve where you have um, the elbow area cut out. It gives support because sometimes you move at night, you lay on the wrong side, and that can really, really aggravate it. So that's the quick and easy, how to eliminate, tennis elbow overnight. Um, some people ask, will tennis elbow heal by itself? Yeah, a minor one will heal by itself. But if you're really heavy duty, hard, balls to the wall out racket sport person, because this goes with squash as well. These minor ones go away. That's where you can respond very well to Advil, leave ice, or topical cream. It takes out some of the swelling. Now, another good question is tennis elbow like arthritis? Not really, because you don't really see it. The pain becomes so much that you're gonna have to act upon it. Arthritis is something that you could be having going on, not even be aware of it. So I think it differs very much from an arthritic condition. Arthritic conditions wear away the joints. Uh, Long term, yes, but I'm not thinking it's as far as this person's question, I think it's completely unlike arthritis. And someone else wants to know what makes tennis elbow worse. Using it too much, poor biomechanics, maybe you need a lesson. Um, so I think common sense is the dictate here. In other words, what's the difference between tennis elbow and tendonitis? Basically, it's the same thing. You know, the tendon gets inflamed, and sometimes the muscles don't respond as well because there's too much tension. Inside the tendon, you have a thing called a Golgi tendon organ. long-winded name, but it's a kind of a stretch receptor. Tendons don't have a lot of give. Now, tendon, as far as you should know, is the end of the muscle. It kind of gets like a rubber band that's wound too tight, and if you overuse it, put too much stress on it, you know, that's going to cause a tendonitis. So these things will make it worse if you overuse it and do not address it. So basically, get some medical advice. Sometimes people will go for cortisone, but if you're still putting extra stress onto the elbow joint, the cortisone is going to last for a little while. Maybe if you have a upcoming match or something you really have to address, then go ahead and get the cortisone shot. But if it prevents you from playing and you've tried the cortisone route, what we do differently at Core Health is we use a bunch of different therapies. We use cupping, which is an acupuncture treatment, cold laser, which vasodilates, infrared, another vasodilator, but also pain response. Um, Shockwave therapy breaks up the adhesions. So we got 4 or 5 really solid therapies. Grossin being another one, which helps kind of get the intracellular fluid out via an enhanced permeability of the cell membrane. You got to think on a cellular level, something is swollen. There's things that are stuck inside the cell have to get out. I find Grossin to be very effective for that, as well as the shockwave therapy. Shockwave is just wonderful. Shockwave, you know, they're using shockwave now for erectile dysfunction. They're calling it powerful wave therapy. I'm calling it what it is, shockwave. We do not do ED treatments here in my office for many reasons. One, I'm not qualified. And two, I don't want to do it. But you know, common sense. You're not getting better. Try something different. But if you would, to if you're going to go in, Google shockwave therapy for tennis elbow, Grostin therapy, tennis elbow, cold laser therapy, tennis elbow. Just hit any of these different things with the tennis elbow in your query, and you'll come up with some pretty good advice. I think so. But again, on the small level, I see people who have typically tried everything else. No one comes to me because I'm a chiropractor with the first thing. So some back pain, neck pain, yes, but it's usually I'm not the first person to go to. I'm the person to go to get it fixed, but I'm not the first person to show up to. Here's another question we're going to go over. Well, what happens if tennis level is left untreated? It will get worse. In some cases, the pain just goes away. That I really can't answer. Um, what does an X-ray show? A lot of times, X-rays don't show much. I mean, unless you're avulsing, where avulsion is where the tendon pulls away from the muscle, pulls the end, the tendon, which is the end of the muscle, pulls it away from the bone. But you're probably better off getting an MRI and not an X-ray for tennis elbow, because you'll see more soft tissue, and that'll help better diagnose and come up with a treatment protocol than you would imagine. Someone else asked a question about, is it better keep your arm straight or bent with tennis elbow? Bent. Um, but again, at nighttime, if you get one of those sleeves, an elastic compression sleeve, I think you'll do pretty good because it'll keep the ligaments tight. Ligaments don't have an excessive amount of give, and a lot of times you move during the night, one arm's under a pillow, or you're sleeping on one side. I know from sleeping on one side because my wife accused me of snoring. I doubt it, but she says so. I'm going to go on my side where I snore less, for what it's worth. So, the most effective treatment for tennis elbow, as I see it, Grostin, shockwave, cold laser, cupping, infrared. So 5 therapies are all good. Somebody else wants to know, is heat good? Heat is good as a warm up. Ice is much better after you play and you inflame the tissue. The tendons of the elbow and the forearm will become inflamed pretty quickly. So pay attention to that. How do you know if tennis elbow is serious? Well, the pain's getting worse. It hurts. You're unable to do your activities. Again, that's a common sense question. So you should know if it's getting worse. Your body's going to tell you unless you have a nerve problem that's precluding you from feeling pain. But typically, that's not the case with tennis elbow. Another one wants to know, will tennis elbow fix itself? At times, yeah. A couple Advil leave, a little bit of ice, maybe a brace, and it's going to go away on its own. Have at it. I tend to like the tougher cases. Which you avoid. We went over the exercise. I mean, anything that's going to put stress on the joint is really what you should avoid. Another person is asking about should you massage tennis elbow. I would say you really need to massage the neck, the shoulder, the elbow, the forearm, and I would do it before you play, much more as a preventative, not as a curative. Um, before or after, give it a day after, maybe two, and a day before is fine. So before or after massage is not going to hurt, can only help. And someone's asking here about is hot or cold better for tennis elbow. Remember, heat to warm it up, cold afterwards to quell the inflammation. And the last question we got, well, no, we got a couple more. I'm sorry. Can tennis elbow come on suddenly? Heck yeah. You can have a traumatic, you might do some micro tears into the tendon that inserts onto the lateral epicondyle or the medial epicondyle for golfers. The golfer's elbow and tennis elbow are basically the same thing. Just one's on the inside of your elbow, one's on the outside of your elbow. So outside lateral, inside medial, lateral tennis, medial golf. How does it take tennis elbow to heal? Depends on how bad your problem is. You know, another person wants to know what happens if you leave tennis elbow untreated. It's going to get worse. So I think I presented enough answer to quite a few questions today. If you got any questions on tennis elbow, shoot us a call, 203-656-3636. If you live in Fairfield County and you're dealing with tennis elbow, golfer's elbow, but also too is the same kind of realm as plantar fasciitis. So plantar fasciitis is another one that's very, very similar. You have tension in the tendon. You got to identify which muscles are involved, work the muscles, check the biomechanics, but also you got to think of let's say let's use plantar fasciitis as a or tennis elbow. You got to look at the whole motor unit. So in the case of a forearm pain, you got to check the neck, shoulder, elbow, hand, wrist, all those things. In the case of a plantar fasciitis, you're going to check the muscles in your lower abdomen on the side that's affected. You want to check the hip. You want to check the knee. You want to check the ankle and the toes. But also as well as all those muscles that are involved with those particular movements. Rarely is it just one particular muscle. I mean, people say, I have a pulled muscle. You probably have several, not just one, because they have to work in conjunction. And extra stress on the muscle creates tension on the tendon, and you can get overuse syndromes like tennis elbow. Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Hope you found this educational today. Probably not going to do another podcast between now and Christmas, but got any questions? Shoot us a call. We're located at 551 Post Road in Darien, 203-656-3636. 203-656-3636. Thanks a lot, and I appreciate the questions that come in. If you got any questions that you'd like to have answered, again, give us a call, 203-656-3636. We're here to help. Have a great Christmas holiday season. Be safe and healthy, and hopefully you'll hear me again soon. Thanks very much.